What if I told you there's one exercise, something so simple, you don't need a gym or fancy equipment, that can restore the strength, balance, and confidence many people think they've lost after 60? It may surprise you, but starting at that age, our bodies quietly lose about 1% of muscle mass every single year. Left unchecked, this silent decline doesn't just make us weaker, can take away something far more precious: independence. And here's the hard truth: just one fall can change everything. But here's the good news: a small protocol made up of just 5 movements can help reverse this process. And it all begins with a motion so ordinary, you probably don't even think about it: getting up from a chair. What looks like a simple daily action is, in reality, one of the most powerful tests of your functional strength. So why is this movement such a game changer? And how can practicing it transform the way you move, age, and live? Let's dive in. Exercise 1. Chair-assisted squat. The chair-assisted squat is more than just an exercise. It's a direct test of independence and one of the most important tools for keeping it. When you perform this movement, 2 major muscle groups do most of the work: quadriceps, the strong muscles at the front of your thighs that extend the knee; glutes, the large muscles at the back of the hips that extend the hip joint. These muscles don't just help you rise from a chair, they're also engaged every time you climb stairs, stand up without holding on to something, walk steadily, or get in and out of a car without losing balance. Research shows how important this motion is. Multiple studies in exercise physiology and rehabilitation have confirmed that the ability to stand up from a chair repeatedly without using your hands is closely linked to health, life expectancy, and reduced fall risk in older adults. According to the American Journal of Preventive Medicine, older adults who regularly perform chair-based squats experience significant gains in lower body strength, faster walking speeds, and better functional performance. Here's the cycle many people fall into with age: sitting more leads to weaker muscles, and weaker muscles make us move even less. That downward spiral can rob us of stability and confidence. But this simple squat interrupts the cycle. It requires no equipment, can be done anywhere, and directly strengthens the areas that age tends to wear down the fastest. And there's another layer to it. When performed slowly and under control, chair squats activate type 2 muscle fibers, the ones responsible for quick, powerful movements. These fibers decline the fastest with age, but they're also the ones that help us react quickly when we stumble. Stimulating them is crucial, even without weights. A Journal of Geriatric Physical Therapy study found that bodyweight resistance exercises, like chair squats, reduce fall risk by more than 30% in just 12 weeks of consistent practice. So what's the prescription? 2 to 3 sets of 10 to 15 repetitions daily. Done correctly, this exercise builds strength, improves balance, and restores confidence in moving freely. Exercise 2. Glute bridge. Next, we move to the floor. The glute bridge is a simple but incredibly effective exercise that strengthens deep muscles without stressing fragile joints. Here's how it works. You lie on your back, knees bent, feet flat on the floor, and lift your hips upward. This action simultaneously strengthens the gluteus maximus, the lower back muscles, and the transverse abdominis, the deepest abdominal muscle. Together, they make up part of your core, the body's stabilizing powerhouse. Why is this important? As we get older, these muscles weaken from both inactivity and natural muscle loss. Weakness here can show up as back pain, poor posture, or difficulty staying balanced. But studies show that glute bridge changes that. One paper in the Journal of Back and Musculoskeletal Rehabilitation found that older adults who practiced glute bridges as part of a 6-week program reported significantly less lower back pain and improved core endurance. Strengthening the glutes also redistributes stress away from the lower spine, which reduces pain and prevents wear. And because the exercise improves pelvic stability, it makes everyday actions, walking, climbing stairs, lifting bags, much safer and easier. The best part: you don't need anything but a mat or carpet. You can even add mindful breathing: inhale as you lower, exhale as you lift, to train motor control and make the core engagement even stronger. Done 2 or 3 times per week, with 10 to 15 repetitions for 2 to 3 sets. The glute bridge helps restore forgotten muscles, reduces pain, and allows freer, more confident movement. Exercise 3. Side plank. The side plank might not look like much at first glance, but it's one of the most complete and functional core strengthening exercises you can do. Unlike the traditional front plank, the side plank focuses on the oblique muscles, those diagonal muscles running along your abdomen. They're critical for lateral balance, torso rotation, and postural alignment. Why does this matter for aging? Many falls in older adults happen sideways. Weakness in the obliques often goes unnoticed until a fall exposes it. The side plank directly addresses that vulnerability by forcing the body to stabilize in one plane. This exercise activates the hips, abdomen, and spine. The result: better balance, stronger neuromuscular control, and improved coordination. Studies back this up. Research in the Journal of Strength and Conditioning. Research shows that isometric exercises like the side plank not only strengthen the oblique, but also increase postural endurance, the ability to hold proper alignment during daily movements. That's crucial, since many falls happen not because the legs are weak, but because the center of gravity isn't properly controlled. Even better, the side plank reduces pressure on the spine by encouraging a neutral alignment. That makes it an excellent option for people who already have lower back pain. To do it, rest on your forearm and the side of your foot, forming a straight line from head to heels. Hold for 10 to 30 seconds per side. Repeat 2 to 3 times a day, and you'll gradually build a strong, stable core. Because it's an isometric movement, it strengthens without stressing the joints, making it especially safe and effective for older adults. The result: reduced risk of lateral falls, better posture, improved movement control, and greater confidence in your daily life. Exercise for lateral leg raises. Now let us focus on a muscle that doesn't get enough attention but plays a huge role in balance. The gluteus medius. Lateral leg raises specifically target this muscle. To perform them, simply lift one leg to the side while keeping your torso upright and stable. Here, why it matters. The gluteus medius stabilizes the pelvis every time we walk or stand on one leg. Without a strong one, the pelvis tips to the side, creating misalignment that strains the back and knees. Over time, this weakness increases fall risk, particularly for adults dealing with sarcopenia or reduced mobility. Research backs this up. A study in the Journal of Geriatric Physical Therapy showed that weakness in the gluteus medius is linked to greater lateral sway while walking and poorer balance test scores. But a 12-week routine, including lateral leg raises, improved gait stability and reduced falls by more than 25%. Strengthening this muscle also prevents knee valgus, where the knees collapse inward due to poor hip stability. This condition can worsen arthritis or cause painful joint issues. The beauty of this exercise is its simplicity. You can do it lying on your side or standing with support from a wall or chair. To make it harder, add a resistance band. Performing 2 to 3 sets of 10 to 15 reps per leg, 3 times per week, can dramatically improve stability and protect joints from strain. Exercise 5. Child's pose. Finally, let's talk about one of the most restorative movements of all, child's pose. It may look passive, sitting back on your heels, leaning forward, arms extended or resting at your sides, but this position does much more than relax the body. It relieves spinal compression, stretches the hips and shoulders, and improves joint mobility. More importantly, it resets the nervous system, lowers stress, and helps the body recover. For older adults, this posture is a gentle way to counteract stiffness that builds up from inactivity, aging, and tension. It also creates gentle traction in the spine. Decompressing discs are a major benefit for anyone with back pain or spinal issues. Studies in journals like Spine Journal and the Journal of Yoga confirm that restorative poses like child's pose lower cortisol, reduce blood pressure, and improve sleep. And it's adaptable. Can't sit on your heels? Add a pillow. Can't touch your forehead to the floor? Use a block or cushion. You can even do it on a bed. The numbers don't lie, and they paint a sobering picture. According to the Centers for Disease Control and Prevention (CDC), 1 in 4 adults over 65 suffers a fall each year. That's not a small fraction, that's millions of people. Even more concerning, nearly 3 million older adults are treated in emergency rooms annually for fall-related injuries. Many of these injuries are not just painful, they're life-changing. Hip fractures, long hospital stays, loss of independence. And too often, once a fall occurs, it marks the beginning of a steep decline. But here's the encouraging part. This is not destiny. This is not inevitable. Science has shown that with the right exercises, simple, structured, and consistent, this risk can be reduced by up to 30% in just 12 weeks. That's a third fewer falls, a third fewer hospital visits, a third more people able to keep living independently, on their own terms. And what's even better, you don't need a gym membership, expensive equipment, or hours of training each day. You just need commitment, intention, and well-chosen movements. The exercises we've talked about so far are designed with exactly that in mind. Why these exercises work so well. The real strength of this program lies not in any one exercise, but in the combination of all 5. Together, they cover the areas most vulnerable with aging. Chair squat gives builds leg strength and power, retrains type 2 muscle fibers, restores functional independence. Glute bridge reinforces the posterior chain, improves core stability, relieves stress on the lower back. Side plank protects against lateral falls, strengthens obliques, improves postural endurance. Lateral leg raise stabilizes the pelvis, improves gait, prevents dangerous misalignments. Child's pose restores flexibility, relieves tension, calms the nervous system. Each one serves a purpose, each one fills a gap, and together, they create a foundation for safe, confident movement. That's what makes this routine so powerful. It's not about building big muscles or pushing heavy weights. It's about training for life, training to walk, climb stairs, stand up, move freely, and live without fear. Evidence from clinical research. This isn't just theory, it's backed by years of research. For example, a study in the Journal of Geriatric Physical Therapy found that standing up from a chair without assistance improves the ability to climb stairs by 25%. Why? Because it strengthens the quadriceps and trains neuromuscular coordination, the connection between brain and muscle. Another study in the Journal of Aging and Physical Activity showed that lateral leg raises not only strengthen the gluteus medius, but also correct pelvic tilt. Poor pelvic alignment is one of the hidden reasons people trip, stumble, or walk unsteadily. Fixing that alignment reduces fall risk dramatically. And there's more. Walking in a straight line, a drill often used in balance training, was shown to improve gait speed by up to 15% in older adults. That matters because gait speed is not just about walking at S1 of the strongest predictors of longevity and independence. Even something as simple as toe raises, lifting your heels to strengthen the calves, has measurable benefits. It stimulates proprioception, your body's awareness of its position in space, improves circulation in the legs, and reduces swelling. These small improvements add up to a more stable, responsive body. Beyond the physical benefits, but the true impact of this program goes beyond muscles and joints. It reaches the mind. Think about it. When you can get up from a chair without strain, walk confidently without a cane, climb stairs without fear, or play with your grandchildren without exhaustion, you don't just move better, you feel better about yourself. Confidence grows, self-esteem improves, anxiety fades, and that sense of control over your own life comes back. This is not just my opinion, it's what the research says. Studies in the psychology of aging consistently show that older adults who participate in functional exercise programs report lower levels of anxiety and depression. They also rate themselves higher in self-image and autonomy. In other words, exercising this way doesn't just strengthen your body, it strengthens your spirit. It gives you back the belief that you can still do the things that matter to you. How to start practicing safely now? If you're thinking, this all sounds good, but where do I start? Don't worry. The answer is simple. Start small, and start where you are. You don't need to do all 5 exercises perfectly on the first day. You don't even need to do them all at once. What matters most is consistency, not perfection. Here are a few practical tips. 1. Choose 1 or 2 exercises to begin with, maybe the chair, squat, and child's pose. Practice them slowly, listening to your body. 2. Use support if needed. Hold on to a chair, use a wall, or place a cushion under your knees. Safety comes first. 3. Focus on form, not speed. Controlled. Why consistency is everything. The secret to aging strong isn't hidden in a supplement, a pill, or an expensive machine. It's found in one simple word: repetition. Because the body adapts to what you ask of it. If you sit all day, it adapts by becoming weaker and stiffer. If you move with purpose each day, even for just 10 minutes, it adapts by becoming stronger, steadier, and more resilient. Consistency matters more than intensity. You don't need to push yourself to exhaustion. You don't need to feel sore for days after. You just need to show up, do the movements, and repeat them regularly. Remember, aging with strength and confidence is not about luck. It's about habit, community, and connection. And here's another secret: you don't have to do this alone. Here on Health 365 Day, we've built a community of people, many of them over 60, who are walking this same path. Every week, we share exercises, tips, and routines designed specifically for older adults who want to live with more strength, balance, and freedom. Your voice matters here. Tell us in the comments which exercise feels the hardest for you, or which one gives you the most relief. Maybe you've had a fall before and want to regain confidence, or maybe you're here to prevent that from happening in the first place. Wherever you are, your experience will help someone else who's on the same journey. So let's build this together. You'll find that encouragement from others, people who understand the same struggles, makes it much easier to stay consistent. A personal reflection: I've worked with countless patients and older adults who thought it was too late to regain strength or stability. They believed the decline was irreversible. But time and again, I've seen how a simple routine, practiced consistently, can completely transform their lives. A woman in her late 70s who couldn't get up from the floor without help after 3 months of practicing chair squats and glute bridges was able to stand confidently and even go back to gardening. A man in his early 80s who had suffered 2 falls in 1 year began practicing side planks and lateral leg raises. Not only did his balance improve, but his fear of walking outside faded, and he started joining his friends on morning walks again. Stories like these are not rare, they're the rule when you commit to functional training. And that's why I believe so strongly in these 5 exercises, because they're not about building a better looking body. They're about building a life you can keep living on your own terms. Now that we've walked through the 5 core exercises and the science behind why they work, the next step is putting it all together into a routine you can actually follow. Because let's face, it's information only matters if it becomes action. The question is, how do you make these movements part of your life in a way that feels natural, safe, and sustainable? Let's break it down. A simple weekly plan. The beauty of this program is that it doesn't need to be complicated. In fact, keeping it simple is the best way to make sure you stick with it. Here's a basic structure you can follow. Day 1, chair squats plus glute bridges plus child's pose. Day 2, side planks plus lateral leg raises plus child's pose. Day 3, rest or light activity like walking, stretching, or gardening. Day 4, repeat day 1. Day 5, repeat day 2. Day 6, overcoming common obstacles. Now, let's be honest. The biggest challenge isn't usually the exercises themselves. It's the excuses and obstacles that get in the way. Here are the ones I hear most often, and how to overcome them. 1. I don't have time. These movements take 10 to 15 minutes. Think of it like brushing your teeth, a small daily investment that pays off in big ways. 2. I'm too tired. Ironically, moving your body actually gives you more energy. Start with just 1 exercise when you feel low, child's pose, or a short set of squats. Often, the fatigue lifts once you begin. 3. I'm afraid of hurting myself. These exercises are chosen specifically because they're safe and adaptable. Use supports, start small, and focus on slow, controlled movements. 4. I've never exercised before. Perfect. That means you don't have bad habits to unlearn. You can build a fresh foundation, step by step. 5. It won't make a difference at my age. Research proves otherwise. People well into their 80s and 90s gain strength, balance, and confidence from consistent training. It's never too late. Staying motivated long term. Motivation is like the weather, it changes. Some days you'll feel excited, others not so much. That's normal. The secret is to rely on discipline and routine, not fleeting motivation. Here are a few strategies that work. Track your progress. Write down your repetitions or time held. Small improvements are encouraging. Pair it with a habit. Do your exercises right after brushing your teeth in the morning or before your evening TV show. Make it social. Invite a friend, spouse, or family member to join you. Accountability helps. Celebrate milestones. When you reach 15 squats or a 30-second plank, treat yourself to something enjoyable. Remember your why, whether it's playing with grandchildren, traveling, or simply staying independent. Keep your personal reason in mind. The bigger picture of healthy aging exercise is powerful, but it's only one part of the puzzle. Other daily choices also play a huge role in maintaining strength and balance after 60. Nutrition. Protein is especially important for preserving muscle. Aim to include a source like fish, eggs, beans, or chicken in every meal. Hydration. Dehydration increases dizziness and fall risk. Drink water consistently through the day. Sleep. Quality rest is when your body repairs and strengthens muscles. Prioritize it. Stress management. Gentle breathing, meditation, or simply walking outdoors can calm the nervous system and improve overall well-being. When you combine functional movement with these lifestyle habits, you create a strong foundation for long-term health. Why this matters so much? Let me bring this back to the heart of the matter. The real goal here isn't just about exercise, it's about freedom. It's about being able to get up in the morning without dreading pain, about walking into the kitchen confidently, not clinging to furniture for balance, about climbing stairs without fear, about saying yes when your grandkids ask you to join them for a walk or play on the floor. It's about independence, and that's priceless. The statistics may sound frightening: 1 in 4 adults over 65 falling each year. Millions hospitalized, but those numbers don't have to include you. With small daily habits, you can protect yourself, strengthen your body, and regain control. A call to action, so here's what I want you to do. Don't just watch this video and think, that's nice. Choose one exercise, just one, and try it today. Maybe it's chair squats, maybe it's child's pose. Doesn't matter which. What matters is that you start. Then, tomorrow, try another. Build slowly, step by step. And before long, you'll notice the difference. Your balance will feel steadier. Your steps will feel stronger. Your confidence will return. And you'll realize something powerful. It's not too late. You still have the ability to shape your health, your body, and your future. Join the community now. I'd love to hear from you. Which of these 5 exercises feels most important for you right now? Is it strength, balance, or flexibility that you want to improve most? Have you had a fall recently, or do you just want to make sure you never do? Share your thoughts in the comments below. Your story might inspire someone else to begin their journey. If this video has been helpful, give it a like. Subscribe to Health 365 Day and turn on the notification bell so you don't miss future content. Each week, we share practical, science-backed strategies to help older adults move with strength, confidence, and freedom. And don't forget to share this with a loved one who might need it. Sometimes the greatest gift we can give someone is the knowledge that it is not too late to reclaim their independence. Final reminder: consistency matters more than intensity. You don't need to do everything perfectly. You don't need to be flawless. You just need to begin and keep going. Because the secret to a long, strong, and safe life isn't hidden in a gym. It's found in small, intentional movements, repeated daily. Even if it's just one exercise today, your body and your future self will thank you. So take that first step. Stand tall, move with purpose, and know that every repetition brings you closer to a life of balance, freedom, and independence.